Hi, welcome to this week's Mental Health Connections. My name is Amanda Manchack. I'm a licensed clinical social worker and an executive director at Connections Wellness Group. Today, we're going to talk about understanding when it's appropriate to find mental health treatment. One of the things that this generation is very good at is identifying their feelings. And so it's important for you to be able to identify a feeling versus the need for mental health treatment. So a lot of the times you will hear kids talk about, I'm depressed, I'm OCD, I'm anxious. And so whenever you have those words come up, it's important to listen non-judgmentally and ask them to give you a little bit more information about that and helping them to understand that feelings are normal. Everybody feels sad, everybody feels worried, everybody feels overwhelmed. But the difference is are those feelings interfering with your daily activities of living? So when you're asking these questions, it's important to talk about, have you noticed a decrease in the way that you're sleeping? Do you have a increased or decreased appetite? Have you stopped socializing as much as you used to? Those kind of things are what differentiate, again, just normal feelings that everybody's going to have, and then something that requires a little bit more of an intervention in mental health treatment. One of the things that you want to do is, again, gather that information and then provide appropriate resources to them. When you're asking them to give you more detail, some of the things you want to be very aware of is, does it sound like this is a crisis situation? A good way to identify if this is a crisis to them, and again, crises are perceived individually, so it's not going to look the same for everybody. But you want to know right now, are they feeling helpless or hopeless about their situation? Are they having current thoughts of wanting to hurt themselves or hurt somebody else? Those are things that are going to require immediate intervention that usually looks like hospital admission and intervention. For Connections Wellness Group, we're there to help you deal with just those chronic feelings of sadness and feeling anxious and overwhelmed. And those can look like our partial hospitalization program, our intensive outpatient program, or even our outpatient counselors that you can work with. So it's important when you go to someone to ask them if they're having just normal feelings or something that maybe needs a little bit more of an intervention, that you make that next step and you always follow up to see if they were able to get to that recommendation that you wanted. So whether it be that you talk to their support system or them and encourage them to go to the hospital, or you encourage them to go to one of their outpatient providers, you really want to make sure that you follow up to see if there were any barriers to getting to that treatment. And if there was, help them figure out how to get past those barriers, because that's one of the things that's going to limit people from being able to get to that treatment, is if they feel like there's too many things getting in the way of them feeling better. So again, just listen non-judgmentally, gather more information. Our kids these days are very aware of their feelings, and just getting more information and understanding the difference between being sad for the day and being depressed and needing to talk to someone about it on a more personal level. Thank you so much for attending this Mental Health Connections, and we hope to see you next week.